So I just make just 3 outlines about the introduction and then the visualization of the liver by EUS, endoscopic ultrasound, and of course the role of EUS in liver disease. So I think all of us, we know that liver and then the pancreatobiliary system is one of the challenging for diagnostic imaging approach. Even though we know that there have been big innovation in the imaging, such as CT scan, MRI, even the PET CT scan, but sometimes it's not good enough. So if we talk about the EUS, of course, I'm not sure how many of you here performing the transabdominal ultrasound as the liver doctor. But we know that EUS examination can give a better visualization. And of course, if we talk about EUS, so sometimes we also can perform the biopsy together with diagnostic visualization. And even now there has been the new innovation for the therapeutic purposes in liver disease. We know that first time the history of the EUS development by the Dimanu is when he performed in the dog studies long time ago. And in the past it's very difficult because we know that the visualization by EUS is not very difficult, not very good or clear images. So for many years then, I think many doctors, even endoscopists, they try to leave the EUS only performing the common endoscopic therapeutic procedure and also ERCP. However, nowadays, I think there have been the big innovation and also changing in the EUS, to overcome about the limited to detect some organs and the presence of the interpose of intestinal gas. So EUS at this moment is not only considered as a diagnostic technique for identification and staging, but also for interventional approach such as tissue acquisition and also therapeutic maneuvers. So we talk about the many endoscopies maybe in your centers performing the EUS. When they do many EUS procedure for the biliary intervention, in fact, they're also looking at the liver, because they always pass the liver when they try to performing the biliary intervention. So this is how the EUS visualization for the liver. In fact, both of the left lobe and the caudate lobe lie in close proximity to the stomach, hence providing an easy access during the EUS examination. Even sometimes there are anatomical difficulty to approach by transabdominal ultrasound. So maybe the EUS can overcome this problem. Other than just the organ, of course, using the EUS, we can also see the appearance not only the liver itself, but also the vasculature in the liver, and also the gallbladder, and also the other things. So this slide just showing that how performing the EUS in the stomach, and then when inserting the scope and then inflating the balloon in the gastric antrum, and then when the scope is connected to the ultrasound machine, and we can see here the ultrasound image directly with the radioscope at the 11 o'clock. You can see that's the liver. Yeah. And then after that, we can just rotate to see all the liver parenchyma closely. And also, the innovation with now, not only with the radioscope, but also with the linear scope, we can be entering the duodenal bulb. And then, of course, with the balloon inflation, we can also see the liver. After we find the two important anatomy, the portal vein, and then also the common bile duct. And then when we follow to the proximal side until the liver hilus, and then we can see clearly the liver parenchyma. So how we find the bridge between the EUS and liver disease? So of course, the role of EUS in the evaluation of hepatic lesion, not only in benign hepatic lesion, but also in malignant, such as liver cancer, hepatocellular carcinoma, intrahepatic cholangiocarcinoma, and other metastatic liver disease lesion. This is how we look at sometimes we know that especially patient with diffuse fatty liver or maybe very small nodule, it's not easy to find the nodule if we only performing the transabdominal ultrasound. And of course, using the endoscopic ultrasound, we can also performing directly the biopsy with the guided from the scope. Yeah. And also the aspiration biopsy. Also, we can see that the patient with possible that malignant gallbladder polyp and the liver metastasis. So the question is the role of endoscopic ultrasound in liver disease. So EUS has shown the superiority in detecting focal hepatic lesions compared with conventional CT and transabdominal ultrasound, especially for the small lesions. And also there's some proposal about how we use the endoscopic ultrasound in diagnosis and management of hepatocellular carcinoma and its complication. For the small lesion or big lesion, and we know that nowadays, other than biopsy, we can also performing the EUS radiofrequency ablation for small nodules, not only in the pancreatic, but also in the liver parenchyma. So this is just to show you that the ability of EUS to detect occult metastatic lesion in the liver that possible missed by CT was reported earlier. Yeah. So based on a study in the US, that stratification of the indeterminate nodules, especially in high-risk patient, can help to change the management of the patient. Yeah. Especially when the EUS is used in detection or characterization of the small lesion less than 2 centimeters. And of course, if a lesion is found by EUS, the cytology or histology can be obtained in the same session rather than performing another procedure at a later of time. And we can also assess about the possibility of the portal vein invasion, spread to other vasculature, and also the lymph node. And using the EUS for the assessment, it seems that most of studies showing that it's quite safety to performing the EUS to evaluating all the liver disorder. Yeah. And of course, the ability to sample and enlarge regional lymph node also can be performed for pre-operative staging. And other study also looking at and showing that EUS FNA of the liver was a safe procedure, which should be considered in the case that lesion is not accessible by transabdominal ultrasound or CT, or even when the FNA is non-diagnostic by these methods, or when a liver lesion is detected during the routine EUS. And this is one that I mentioned before, the potential advantage of EUS in the management algorithm. That the therapeutic role, there's a tumor ablation by intratumoral injection, of course, that usually that performed by interventional radiologists or maybe interventional hepatologists by using the alcohol ablation or maybe radiofrequency probes. And we can also place the fiducial for the stereotactic radiotherapy, brachytherapy using the radioactive seeds. And other things, we can also performing the EUS guided biliary drainage in case that there's a biliary obstruction due to the malignant liver lesion. This is how to, just to show you that how the needle entering the nodules and the ablated process. And it's showing the needle tip is almost similar that interventional radiologists usually perform for the percutaneous RFA for the liver. And other role of the EUS, of course, if we talk about portal hypertension, that nowadays also there are many studies showing that the EUS have been used for the therapeutic for the gastroesophageal varices. We know that EUS can also use to evaluate the paraesophageal varices, that sometimes that we cannot sure when we only performing the common or usual the endoscopic diagnostic procedure. And during that procedure, we can also evaluate the possibility of the GOV or maybe IGV, and in the same session, we can do the hydroalkyl injection for the treatment of the gastric varices. So this study just showing that even in still very small number of patients, but they can show that there's a significant role using the EUS for the gastroesophageal varices treatment. So the endoscopic and ultrasound images provided by EUS allow the visualization the collateral vessels within and outside the esophageal wall. Yeah. And of course, it allows us to identify patients who are at higher risk of variceal recurrence and rebleeding, and to select who require a closer follow-up and even more aggressive endoscopic approach. Of course, we know now there's also the endoscopic ultrasound for elastography. So even though that most of us and even the oncologists still need the biopsy specimen, but we know now there's the innovation doing the EUS elastography for the differential diagnosis between the benign and malignant focal liver lesion. And also that we can use also the EUS for the contrast harmonic for the assessment of liver disease. Yeah. And I think the last one, that just very recent study, when they use the EUS to do the portal pressure measurement, yeah, with the simple novel device, yeah, and they can showing that this is quite accurate to measure the portal pressure when patient is also sedated. So I think, ladies and gentlemen, and Mr. Chairman, so in my conclusion that innovation in EUS technology has opened a new bridge between the endoscopy and hepatology. It is a promising tool for diagnostic and therapeutic procedure in managing liver disorders. However, the training, curriculum, cost, and availability I think still need more to be considered before it is approved as a standard tool. For that, I thank you very much.